My name is Eamon O'Connell. I'm a vet with Summerhill Veterinary Clinic in Neenah. We're in North Tipperary. We are a 9-vet mixed practice. We cover a decent area from Birdhill to Moneygall all the way down to Lough and we're a predominantly dairy practice. Today we're on the farm of Shane Hanrahan in Ballycommon, just outside Neenah. The impact of a coccidiosis outbreak on a dairy farm. Firstly, the labour that's involved in treating sick calves, administering fluids to those sick calves. The second thing is the stress. The physical stress obviously of the extra workload, but the mental stress as well of watching your calves sick and hoping they'll recover. But the third thing is the effect on daily live weight gain. All the way through from your calves, all the way up to your replacement heifer calves. Are they going to reach target in 2 years' time? My experience with coccidiosis over the past number of years has seen it becoming a very prominent disease in young calves. We've been in practice in Neenah for 15 years now, and when we started out, it was pretty much unheard of, whereas now we figure it's probably the main cause of disease in young calves. So, for example, on Shane's farm, in recent years, he's had an issue with coccidiosis of grass. 2 to 3 weeks post-turnout, we've seen clinical signs of coccidiosis in his calves. But also in our practice, we've seen a number of farmers that have issues with coccidiosis indoors. So you have calves move from individual pens to group pens, have developed signs of coccidiosis, and similarly, after a stressor such as dehorning at 3-4 weeks old, we've seen coccidiosis develop after that as well. There are a number of steps a farmer can take to reduce the chances of a coccidiosis outbreak, both indoors and outdoors. So indoors, firstly, we look at hygiene, keeping your feeding equipment clean and disinfected, then looking at your calf pens and calf shed, keeping that cleaned, disinfected with a nice comfortable straw bed. Then when we move to outdoors, firstly we need to look at the paddocks last year that were a source of coccidiosis and avoid those if at all possible. Secondly, we need to look at the water troughs and the feed troughs. It needs to be clean and dry around those, so if it starts to get mucked up or wet at all, we need to move them if possible. We also need both indoors and outdoors to implement a rigorous preventative strategy. If a farmer has had a historic issue with coccidiosis in the past and wants to prevent reinfection this year, the first thing they should do is get in contact with their vet. They'll call out and come up with a full comprehensive preventative plan. Firstly, that will start with hygiene, keeping your feeding utensils clean, keeping your calf sheds cleaned and disinfected, warm, dry straw bed. Then we'll move on to the individual calves. When they leave the individual pens into the group pens, they'll be left there for at least a week to get exposure to the parasite, and then the whole group will be treated with Vicoxan as a preventative. Similarly, outdoors, when calves are turned out to grass, they need exposure to the parasite again. So 2 to 3 weeks after turnout, the whole group then can be treated with Vicoxan. On Shane's farm here, he has had a historic problem with coccidiosis. So he lets his calves exit the individual pens into the group pens, leaves them there for a week to 10 days, and then treats the whole pen with Vicoxan as a preventative. Similarly, when his calves go outdoors, he knows the paddocks that have had historic coccidiosis issues in. He leaves the calves in there for 2 to 3 weeks and then treats the whole group with Vicoxan as a preventative again. If we suspect that there is an outbreak of coccidiosis on a farm, whether it's in an indoor or an outdoor setting, firstly we should look for clinical signs. And the clinical signs we need to look for in a sick calf with coccidiosis are very, very loose feces, raised tail head, possibly straining. But it can also be an awful lot more subtle, where calves just have a reduction in daily live weight gain. So if we suspect that there's calves suffering from this, the first thing we should do is contact your vet. Get the vet to call out, have a look, diagnose it by clinical exam, but also diagnose it by taking fecal samples. And once we've detected coccidiosis in those fecal samples, we need to get in and treat the whole group with Vicoxan as a preventative. Because if one calf is sick with it, we have to presume that a number of calves have subclinical coccidiosis also. The advantages of using Vicoxan are, firstly, it can be used in animals of any age or any weight. So both on sheep and on cattle, on lambs and calves, both indoors and outdoors. Secondly, it can be used as a preventative. Its active ingredient, declazeryl, has a short duration of action, which allows exposure to the parasite and development of natural immunity. This reduces the risk of reinfection going forward. Vicoxan is also environmentally friendly. Also, studies have shown that dairy heifers treated with Vicoxan have had a better average daily live weight gain than those treated with a toltrazuril-based product. The administration protocol for Vicoxan is that it's given orally at a rate of 1 ml per 2.5 kilos. So a 50 kilo calf gets 20 ml of Vicoxan. It's safe to use on both sheep and calves of any weight. So if you suspect you have a problem with coccidiosis on farm this spring, or you've had a historic problem, contact your vet to formulate a preventative plan for the spring going forward.
I'm Shane Hanrahan. I'm milking 110 cows here outside Neenah in County Tipperary. The spring calving going good. Kicked off 7 or 8 days ago. We've about 25 cows calved. Every calf is stomach tubed. Beestons is tested, and then the calves come over here where they see out the remainder of their time on the farm. To get ready for the spring calving here, first of all we empty out the shed after the summer. It's generally full of machinery, and we steam clean the whole place and thoroughly disinfect it. Then once the calves come over here, every 10 days the shed gets cleaned out fully and we disinfect it again until the shed is empty from calves. Historically we have an issue with coccidiosis, so this pen we come in at 4 weeks and every calf gets treated with their first dose of Vicoxin. Then we let out the calves. Calves generally get let out into the same paddocks because they're the best fenced. And then 3 weeks post turnout, we give them a second dose of Vicoxin, and we found that this works brilliant. We use Vicoxin here because we find it the best. We've tried other products, we didn't find them as effective. Spoke to him and the vet about preventative measures to prevent coccidiosis on this farm. We set out a plan for coccidiosis. We're using it now. We've no issues with scour, we've no issue with calf health, and we're going to stay using it going forward as a preventative measure against coccidiosis.